Good afternoon, everyone. Good afternoon and welcome to the launch of the Roberto R. Romulo Fellowship for Public Health, Leadership, and Governance. As you all know, today is a very significant day for all of us present here today.
So to start, may I request everyone to please rise for a few moments of silence as we each pray for our intentions. And this will be followed by the singing of the Philippine National Anthem.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang mag-ibig, telas ng sinangalan, alam ng puso, sa dikit mo'y buhay. Lupang hinirang, tuyang ka ng magiting, sa mandulupin, di ka pasisigil, sa gagatang tutok sa simoy at sa langit mong pagaw, ay hinatang tulad awit sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na nag-iindig, ang bituin at araw niya kailan ang may di magtitindig. Luman ang araw ng walhabing pagsinta, buhay langit sa piling mo. Ang inigaya na pagkay mga aking, ang mamatay ng dahil sa'yo.
You may now all be seated. Again, a pleasant afternoon to everybody. I am Dr. Ellen Medina from Zulig Family Foundation.
And I'm Professor Abby Duarte from the UP College of Public Health and will be your hosts for today.
This year, the Zulig Family Foundation, or ZFF, celebrates 15 years of working with local government health leaders to deliver better health results in communities. Over the years, ZFF has established its strategic niche in building leadership competencies and delivering programs that address systems that perpetuate inequities in healthcare. All of this were made possible with the able leadership of its founding chair, Ambassador Roberto R. Romulo, or Triple R as we fondly call him, who directed the foundation's work towards addressing health inequities, especially in rural communities.
Therefore, in honoring his memory, ZFF, in partnership with the UP College of Public Health and the UP National College of Public Administration and Governance, collaborated and developed the Roberto R. Romulo Fellowship for Public Health Leadership and Governance.
So it is for this reason that we are here this afternoon. So today, you are all invited to witness this important occasion. We will commemorate Ambassador Romulo and who he was. We will also learn more about the fellowship program, and we will get to know the first 8 Romulo Fellows.
Please also note that we are live streaming this program via Zoom and Facebook so that those who are unable to join us in person would still have the opportunity to witness our gathering this afternoon.
And speaking of social media, so for those who are posting also on their social media accounts about this activity, please do not forget to use our official hashtags, hashtag RRR Fellowship, hashtag Romulo Fellows 2024, and ZFF at 15.
Without further ado, let us now listen to a message from the Chancellor of the University of the Philippines, Manila, Chancellor Carmencita D. Padilla, for her welcome remarks.
Mr. Marlo Iringan, Undersecretary for Local Government, Mr. Daniel Zwillig, Board of Trustees member, Zwillig Family Foundation, Professor Ernesto Garilao, Chairman of the Zwillig Family Foundation, Mr. Austere Panadero, President of the Zwillig Family Foundation, Dr. Christopher Burse, Dean of the UP National College of Public Administration and Governance, or NCPAG, Dr. Fernando Garcia, Dean of the UP Manila College of Public Health, the family members of the late Ambassador Roberto Romulo, and other officials of the Zwilig Family Foundation, other DOH and DILG officials, officials from the UP College of Public Health and the UP NCPAC, other guests, ladies and gentlemen, good afternoon. I thank you for the honor of having me welcome everyone to the launching of the Robert R. Romulo Fellowship for Public Health Leadership and Governance Program. It has been a year since we sadly lost the ambassador, Ambassador Romulo. This is not just a loss for the Zwilig Family Foundation, but also for the Filipino nation. Ambassador Romulo moved mountains, so to speak. He pushed ZFF to forge partnerships with various LGUs and move them to improve health systems and eventually the health status of their constituents. If I were to coin a moniker for the ambassador, it would be the operator. He operationalized, he empowered, and with this, he succeeded. The operator's corpus is gone, but his spirit and legacy remain. And it is what we celebrate and what the ZFF, the CPH, and the NCPAC plan to keep alive through this fellowship. The RRR Fellowship aims to utilize the personal leadership skills and vision of governors and other provincial officers to help attain better health outcomes in their respective provinces. It will also help them develop a deeper understanding of their roles as highly essential public health leaders in their constituencies. Simply put, this fellowship will help sharpen the acumen of LG officials with regards to their local health issues and responsibilities. This is truly a grand initiative, and I express my admiration and felicitations for the ZFF for this program. The whole UP family is heartened by this endeavor because its success will be a shining example of the university's mandate. And even as my term as UP Manila Chancellor ends, I will keep tabs on the RRR Fellowship as it parallel to my lifelong work, the care and protection of Filipinos' health. Again, my congratulations to ZFF and to all involved partners. Mabuhay kayong lahat.
We thank Dr. Padilla for that message. And now it is time for us to understand a bit deeper why we are all here. So to further walk us through the Romulo Fellowship Program, may I now invite the chairman of Zwilig Family Foundation, Mr. Ernesto D. Garilao.
Good afternoon, everyone. Let me greet Olivia Romulo, Liana, Maritina, and Anton, the brother Dick, our Board of Trustees, Bobby's friends in government, private sector, ladies and gentlemen. I'd like to talk to you about Bobby Romulo and his influence on public health in the Philippines. I've known Bobby for decades. Our paths crossed many times when he was first treasurer and trustee of the Philippine Business for Social Progress. When we were members of the Ramos cabinet, he as Secretary of Foreign Affairs. And in 2008, when he was CFF chairman, he invited me to join the foundation. He took his foundation leadership seriously and how ZFF operationalized the vision of the late Dr. Stephen Zwilig of health for the poor. He also ensured that the foundation and its work would be reflective of the family's commitment to the land of their birth. He guided the foundation not to stray beyond the intentions of the family and that the foundation will have a unique contribution in public health, specifically in health leadership and governance, and the involvement of local government and its executives. When he died in 2022, ZFF had become a major player in public leadership and governance. Currently, the foundation's scale of involvement is reasonable as we work with 5 DOH regional offices in the implementation of universal health care with 20 provinces and their governors, 5 provinces in reducing stunting and wasting in nutrition, 20 cities in family planning and adolescent sexual and reproductive health, strategic partnerships with resource organizations with co-financing arrangements, and 10 regional academic partners which provide health leadership and governance training. Throughout his life, Bobby stood for certain principles. One is service and commitment to country. Second is the imperative of professionalism and competence, which stood out in eulogy after eulogy that was offered during his wake. And third, he was always looking for metrics. If we are to do the intervention, we need clear measure of success. He was also a global Filipino. He wanted the Filipino to break away from its insular mindset and its leadership and institution benchmark globally if it is to be competitive. In honoring the legacy of Roberto Romulo, the CFF Board of Trustees wanted a living memorial, a fellowship program that would carry on his values and principles, and as a result, enable public health leaders to embrace their accountability to improve health status of their constituents. In this context of universal health care, we recognize that provincial governors and their provincial health officers will be in the best position to initiate these changes in health. The UHC is a game changer in public health, but its implementation is a challenge. It requires co-ownership of different stakeholders in co-creating new institutional arrangements. With the law, provincial leaders need to foster collaborative relationships with DOH and PhilHealth, as well as the engagement of local mayors and municipalities for the integration of services, management, and resources. It also requires participation of the community to ensure access and delivery of relevant health services. All these require not just political commitment and persistence, but also new knowledge, new skills, and new competencies. The Roberto R. Romulo Fellowship Program for Public Health Leadership and Governance therefore comes as a response to these emerging needs. It aims to produce a cadre of public health champions that will address health inequities more effectively. Because of this great task, ZFF is in partnership with the country's premier institutions on public health and governance, the UP College of Public Health and the UP National College of Public Administration and Governance in developing and implementing the fellowship program. The governors here today were invited to join the program based on a set of criteria: that their provinces have health challenges with limited resources, but whose leadership have the commitment to pursue the goals of universal health care. They are first-term governors, potentially with a runway of 9 years to implement universal health care. We also hope that the values that Bobby stood for, along with the new leadership and management knowledge and skills, will be used to address other development challenges in the province. Much will be expected from the Romulo Fellows, but we also assure them that they will not be left alone in this journey. Our presence here today is one manifestation of our support as they venture in this journey. And Bobby would appreciate that. Once again, thank you everyone for being here with the governors and the provincial health officers this afternoon. Marami pong salamat.
Thank you very much, Sir Ernie, for sharing about your experiences of working with the ambassador. I'm sure his family, who is here with us this afternoon, really appreciated listening to your stories. And with that, let me take this opportunity to also recognize the family of Ambassador Romulo. Today, we are honored to be joined by his wife, Mrs. Olivia Romulo, his children, Anton, Liana, and Maripina, as well as his nephews, nieces, and all of their other members of the family who are present here this afternoon. Thank you very much for being here with us today.
Now that we have an idea of the fellowship program, let me now call on Dr. Fernando B. Garcia Jr., the Dean and the Center Director of the UP College of Public Health, to introduce to us the first group of the Romulo Fellows and Associate Fellows.
Thank you, Dr. Ellen and Prof. Abby. So, good afternoon, everyone. It is my distinguished honor to introduce to you the first group or first batch of the Romulo Fellows and Associate Fellows. For the information of everyone, the final selection criteria for the fellowship considered the province health situation as well as the governor's individual attributes. Provinces with existing health challenges were prioritized, especially those in the more disadvantaged areas. The governor has to be serving his or her first term, is dedicated to improving the health outcomes in his or her province, is able to generate and pursue innovative ideas, and open to engage with relevant technical experts and other fellows in the program. We have selected provinces from all islands to ensure that Luzon, Visayas, and Mindanao are represented, and that they come from different income classes. Once the governors have been selected, we also invited their respective provincial health officers as associate fellows, as the PHO or the provincial health officer is one of the most important partners that the governor has in implementing the health reforms and innovations. May I request them to come up to the stage as we call your name, and please stay for a photo op afterwards. From the province of Kalinga, Honorable Governor James S. Iduba and Provincial Health Officer Dr. Edward B. Tandingan. From the province of Aklan, Honorable Governor Jose Enrique Miraflores and Provincial Health Officer Dr. Leslie Ann Loses Cedillo. From the province of Davao de Oro, Honorable Governor Dorothy M. Gonzaga and Provincial Health Officer Dr. Antonio P. Ebiernas Jr. And from the province of Dinagat Islands, Honorable Governor Nelo P. Demery Jr., and Provincial Health Officer Dr. Vin Johan S. Malapas. Congratulations to the country's first Romulo Fellows on Public Health Leadership and Governance. May you continue to uphold the values of Ambassador Romulo on service to the underserved, professionalism, and excellence. Thank you very much, and let me turn you back to Professor Abby and Dr. Ellen.
Thank you, Dean Garcia. So as we mentioned, we will now have some very important photo ops with our fellows at this point in our program. So now that we have met our fellows and associate fellows, can we have a few photos taken of just them from our official photographer? Please give us your best smiles. Right. Right. So thank you very much. At this point, may we now ask the Romulo family to please join our fellows on stage. Mel will be guiding you as you go to the stage. To the rest of the audience, please bear with us. We are creating history today. So we need to make sure we take good photos of this moment. Press down. All right. Thank you very much to our Romulo family and our fellows. We'll have one more group. So we will now request a photo of our fellows with our ZFF Board of Trustees. May we request, you may take your seats again. Please take your seats. We'll now ask the members of the board of the Zulig Family Foundation to also join our fellows on stage. Thank you very much.
Thank you.
Another round of applause, of course, for all of our fellows and associate fellows. All right. So at this point, I will now request that our governors remain on stage and our PHOs may now take your seats again off stage for the next part of our program. No.
So before we proceed to the next part of our program, we would also like to recognize the faculty members of the UP College of Public Health, the UP National College of Public Administration and Governance, and the Zwillig Family Foundation, who will serve as resource persons and facilitators for the fellowship program. Please rise to be acknowledged. Ladies and gentlemen, let's give them a round of applause. Thank you. You may now be seated.
Thank you very much. So by now, I'm sure everyone would be interested to hear from the governors themselves, who are also looking very much excited at this point in the program. So I'm sure we want to hear about what they intend to do as Romulo Fellows. So to moderate our conversation with the fellows, let me now call on from the UP National College of Public Administration and Governance, Mr. Rafael N. Montes Jr.
We would also like to invite to the stage Dean Fernando B. Garcia Jr. of the UP College of Public Health and Mr. Ostier Panadero, ZFF President, to join our fellows in the conversation.
Thank you, Doc Ellen and Prof. Abby. Good afternoon, everyone. Good afternoon, governors. Nice to see you again, sirs and ma'am. It is a profound honor for UP-NCPAG to be part of this pioneering engagement with ZFF, especially our two colleges who come from two autonomous units of the university both have public in our titles, which means that our mandate is committed to the service of the Filipino public. On behalf of our dean, I would like to express our thanks to ZFF, to the Romulo family, and to CPH for involving us in this endeavor. But this part of the launch, we will get to know our fellows. The Romulo Fellowship is quite a prestigious program that will be open to only a few select leaders at a time. So let's just say that since you're the pioneers, you're also already the elite at the moment. It requires a lot from you as individuals as you continue with your job as leaders of your provinces. So let me begin with Governor Miraflores, sir. What made you say yes to the program?
Easy because good afternoon to everyone. It is easy for me to decide because I want to do more in terms of our health agenda in our province, and as their leader, I want to be equipped of on how that I will convince all of our stakeholders to join me, to trust me in helping change the healthcare system in our province of Aklan.
Thank you, Gov. That's a very inspiring answer. Not a lot of our provincial leaders actually prioritize health in their agenda. As we've had our discussions in our first module, you know, local governments are general purpose authority, and you have other services that compete with health. Let me turn to Governor Eduba, sir. May I ask you, how did you arrive at the decision to make health as a priority, one of the most important priorities during your term as governor?
First, good afternoon, everyone, and let me thank the Romulo Foundation for sponsoring this and continuing this legacy. The Romulo family, I should say, and of course the SWI League and the UP and the partners, and to USEC, both personal and also related to the program of health in our province. As a first-term governor, we coined this Luminawa. It is actually a local term for state of well-being, and this spells 8-point agenda for the province of Kalinga on health and governance, especially on health because 46% of our barangays are GIDA, and the rest. We also started a program. A program wherein we started to build 3 hospitals, and I don't know where to find the rest of the resources to continue to finish this. Personally, also because I started as a mayor and I have seen how the life of the people in the barangays. And if you concentrate on health, if you give priority on health, and you can really see the impact of your decision with regarding to health. And from there, that's why I also joined the MLGP. And then later on, when I become this, I joined the provincial government. I took this as also as a challenge of giving priority to health, as mentioned by Governor Mira Flores here. I also want to borrow the term used by one of our professors, the VUCA, the VUCA-ness of this world in terms including health is very challenging. And with this introduction of the universal health care law, which which this first term governor will implement, I'm really interested to join. I am so lucky that I was chosen as one, and I'd like to take this as a challenge and will do my best to participate in this, and to see to it that the Romulo legacy on health and governance will continue. Thank you.
Thank you, Gov. Sounds like a strong vision. But Gov, this is not a graded panel. So, but thank you for mentioning a takeaway from module 1. Okay, let me turn to Governor Demaray, sir. What would you say would be the most pressing areas of concern in your province when it comes to health? Given that Gov
thank you.
Ituba mentioned about the geographically isolated, and you come from an island province.
Yeah, thank you. Before that, I'd like to thank the Romulo family, the Romulo Foundation, the Zwilig Foundation, of course, UP Insipag and UP College of Public Health. Of course, it's very common in the Philippines. We all know that we have almost the same problems. For us in the Nagat Islands, I am situated in the heart of Visayas and Mindanao, and I am an island province. To reach my province, you got to sail by boat around 1 hour or more. And we have many island barangays that needs really help. So the main problem is, as I said, we have the limited access to healthcare services, like being experienced by Parplang barangays in the Philippines. Aside from that, the unfunding and resource constraint, because we are considered fourth-class province, so we don't have much for health services, and we don't have even much for infrastructure, and for food, how much more for health. We have also problem on infrastructure and technology gap, because as I said, being an island, no doctors would like to go and serve our people, because it's very lucrative to practice in urban areas than go to provinces like us. The things that we had been doing when I was board member, I started from board member for 1 term, then vice governor, then governor. I started the scholarship program for medical scholarship program in my province, that we sent doctors to students to study to become a doctor of medicine and pay us back. We have this medical scholarship program that I started when I was board member. So we have produced around 6 already. Of course, hindi na to tatakas taga-amin kasi yung doktor eh. So, and at the same time, we are also coordinating with the UP College of Medicine. We sent in the regionalization program of the UP College of Medicine. In fact, for this year, we are lucky we have 2 that are studying for medicine in UP. And one of that is my daughter. So that surely my daughter will serve my province. And there are a lot more of things that we are trying to do, and I'm so happy that I am included here to be able to learn more and to be able for us to really bring the services to our people. We are saying that the universal healthcare program can really solve the problem to serve our poorest of the poor. but the poorest of the poor cannot even avail this program, as we had been talking, because the problem is those really poor cannot even go to the hospital for the free services because they don't have the money and the access for transportation. Example, in my province, that there are more than 20 barangays that you have to take a boat going to the center and to take a bangka going back to your place. And that's how difficult health services in my province. Thank you very much.
Thank you, Gov. Demery. Leading by example, but really some tough challenges. And I'm sure the challenges are shared by a lot of the places in the Philippines. It would definitely take a lot to be able to address those. Let me turn to our fourth, but certainly not the least, governor. She's certainly the prettiest of the fellows. Gov Gonzaga, what support do you think you will be needing in order to address the health issues in your province? What support do you think you will be needing in order to address the health issues in your province?
Okay, good afternoon, everyone. We need all the support. Right after we had the first session last August, the PHO team, of course, led by our Dr. Bong Ibiernas, and the rest of the PGO family immediately had a meeting, and we agreed that we really need a lot. We still have a lot to do as regards the situation of our health services in our province. So we agreed on a comprehensive solution to this problem. We identified many factors that could really help us improve our healthcare system. So among which is our tapping the support of our stakeholders, from our internal stakeholders, especially those from our municipalities, our mayors, so that they will take care of their barangay health stations, their municipal or the rural health units. And in our province too, we have several big mining companies who are already operating in our areas, and as well as those who intend to operate pa. So we have knocked on them for support because it's not easy to really fund and implement our health programs. So DOH, ADB, and all external stakeholders such as the Zwillig Foundation, the Romulo family, we very much welcome all the support that you could give to our province. Thank you.
Thank you po, Governor Gonzaga. It's good to hear the insights from our governors, but they mentioned the elephant in the room, which is the Universal Healthcare Act. So let's ask the doctor in the panel. Dean Garcia, what do you think are the key leadership actions that our governors can take as they begin their work of being champions for health?
Okay, thank you. Well, after listening to our four governors, I have actually listed at least three leadership actions. There are a lot, of course. No? It was mentioned a while ago that they have undergone to the module 1. No? And I believe one of the recommendation coming from me would be using those learnings from module number 1 is to come up with adaptive strategies. When we talk about adaptive, it requires time, no? It requires patience, it requires behavior change. No? So come up with those adaptive approaches to actually strengthen the stakeholder relationship. That's the first one. The second one is that I'll be using the Bridging Leadership Framework. It was mentioned a while ago by Honorable Governor Iduba that he actually participated in the MLGP and the PLDP. And in that Bridging Leadership Framework, we have the co-ownership and co-creation. And with that framework, one of the recommendation would be to really develop this intersectoral collaboration. When we talk about intersectoral collaboration, this includes the non-health. So it's not just the health alone that we need to engage with. So we need to engage with the public works, we need to engage with the other non-health sectors, as well as not only the sectoral engagement, but also community participation. It's very important, especially when we want to really achieve universal healthcare. No? So those community participation and intersectoral collaboration would be our governor's mechanisms towards attaining that co-ownership and co-creation. And the last one maybe is to come up with innovative strategies. So yung dating ginagawa na, maybe with the VOCA environment that we have, yung dating ginagawa na, that would not be effective at all. We need to come up with innovative solutions in addressing our persistent and remaining challenges of the province. So I think that's all. Baka mapahaba mag-lecture na.
Thank you, Dean June. The fellowship is a good opportunity for the governors and the provincial health officers to initiate the health reforms. Sir Austere, maybe you can explain a bit about the kind of support that our fellows can expect from our program.
Thank you. And first of all, thank you very much, Gobs, for being here and sharing your thoughts on your health challenges and give us indication as to where you want to bring your province in terms of health outcomes in the immediate future. Well, the program is trying to sort of respond to the UHC requirements as we are all confronting today. But with emphasis on helping each LGU navigate that journey in terms of implementing UHC. So this is really a LGU-specific program, and which is driven by the needs of the local governments. There will be maximum interaction, while there are common leadership inputs, as Dean June mentioned, but the application of those leadership to solve specific problems will be tailored fit to the requirements of the province, be it a resource mobilization, be it your infrastructure. So the program commits to make available to you through mentoring, coaching, and technical assistance the kinds of information, competencies that are vital to achieving your mission as well as your vision of really improving the health outcomes of your province. This is not going to be easy, and as I recall, our first interaction last 2 weeks ago, 3 weeks ago, if I recall, your concern for data was really very clear. I cannot forget the comment of Governor Gonzaga. Kailangan balikan ang data. Mukhang kailangang linisin. So in fact, that would be, I think, a major challenge, as Prof. Ernie mentioned. Ambassador Romulo has emphasis on metrics. So I think that is a good start and will help out in terms of improving your health information system in that regard. So we will keep track as well of the progress of everyone and update all our partners here of the progress of the 4 provinces, hoping that along the way, in some way or another, some kind of encouragement, inspiration, and support can be provided to our partner provinces. So that would be, in a nutshell, what our partner governors can expect from the program. Thank you.
Thank you, Sir Austere. And also thank you to all our panelists. Just to briefly put a punctuation to our conversation, a matter of reflection from our end, especially NCPAG, which works a lot with local governments. We have always said that each local government is unique and that health challenges vary from one local government to another. Yet health outcomes are universal. And it is our hope that our fellows will become the catalysts for a new horizon in health service delivery for our kababayans. And there is truly much to look forward to when it comes to our fellows and associate fellows. Okay, thank you, everyone. And let me turn you over back to our hosts, Prof. Abby and Doc Ellen.
Thank you, Mr. Montes. And again, may we request all of our panelists to stay here together with our moderator for another photo op. Smile. All right. So our governors were talking about the health situation in their respective provinces. So if you would like more information, we also have posted outside some tarpaulins that contain specific details on the health situation in each of their provinces. So you can go through them later at the end of our program, and it can start some conversations between you and the governors and of course our PHOs as well. Yeah, so at this point, thank you very much. And we'd like to ask Dean June, Sir Austere, and Mr. Montes to, you can now take your seat off stage. Governors, please still remain. Yeah, may exam pa daw po kayo. So thank you again, fellows, for sharing your insights with us. And we look forward to hearing more from them. So as they progress through the program, we look forward to hearing more about your health innovations and reforms that you will be implementing in each of your provinces.
Thank you again to our fellows. So as a sign of your commitment to see these through, we shall now proceed with the ceremonial signing of learning contracts for the Romulo Fellowship Program. So you should be receiving a folder with the contracts in it. May we therefore ask the associate fellows or PHOs to please join them here on stage.
You may read through it first. So while you're reading through it, you don't have to sign yet. You can review it first. But as a sign of support for the fellows, may we also ask the following to witness this ceremonial signing and join our fellows on stage as well. So may we ask the Romulo family to be represented by Miss Leana Romulo to join them on stage behind our fellows. ZFF to be represented by Daniel Zulig and Ernesto Garilao to also join them on stage as witnesses. UP Manila to be represented by Dean Fernando Garcia Jr. UP Diliman to be represented by Ms. Marie Chris de los Santos. And DILG to be represented by Yusek Marlo Iringan.
Okay, so governors and PHOs, no, while waiting, please ready your pens. So you may now sign your learning contracts. May we give them a round of applause, no, as they sign these contracts. May we also request our fellows to show the signed contracts to the audience and towards the camera so we can document this momentous event.
For everyone's information, they signed what we call a learning contract, wherein they're committing to really follow through on the entire fellowship program.
Ladies and gentlemen, let us again give a round of applause to our Romulo Fellows 2024.
Thank you, witnesses. You may now take your seats off the stage. To our fellows and associate fellows, we also present to you a token to remind you of your commitment to be leaders and champions for health in your provinces for the achievement of better health outcomes for your people. So now our team will be giving you tokens so that you do not forget the commitments you made today.
So once you receive your tokens, no, please rise. No, so a photo of you may be taken with the tokens.
Right. Can we have one photo daw po of all the fellows standing up with your tokens? The token officially names them as Romulo Fellows and Romulo Associate Fellows 2024. Since they will be finishing the program next year.
Thank you, fellows and associate fellows. You may now take your seats. The associate fellows may return to their seats off stage, but the governors are requested to remain. Apologies, no. Please return to your seats off stage. Thank you.
It's okay, you can leave them po. We will collect them afterwards. Thank
Thank
you.
you very much. Okay, so thank you po. Thank you. Thank you, everyone. We look forward to what our fellows and associate fellows will be doing as a follow-through on their commitment, because the challenge of addressing health issues is truly complex. It is also important for our fellows to know that they will not be alone in this journey. That right now, they are among partners and stakeholders who in one way or another can support them in their journey to achieving better health outcomes.
So that's right, Prof. Abby. So at this point, we would like to acknowledge the presence of everybody here today. Please know that you have been invited here today by virtue of being a part of Ambassador Romulus Networks. You are ZFF and UP's partners, as well as public health, leadership, and governance experts, coaches, and mentors who can contribute to the fellows' efforts as they work on their respective provincial health systems. This afternoon, we are honored to have in our presence, we have former ambassadors, we have key leaders from the private sector, we have former and current cabinet secretaries as well as their representatives. We have the ZFF Board of Trustees, we have partner foundations, organizations, and individual experts, as well as other friends and partners who have come to join us today. So to further inspire our Romulo Fellows and Associate Fellows in this program, may we now call on the daughter of Ambassador Romulo to represent the family, Ms. Liana Romulo, for her message.
Oh, I have to hold it. Good afternoon. I'm Liana Romulo. I'm the middle child of Bobby Romulo's 3 kids. And today I represent my mom, Olivia, my siblings, Maritina and Anton, and his partner, Becky, and my dad's brother, Ricardo Romulo, First, I would like to extend my family's most profound gratitude to the Zulig family, represented here today by Daniel and Miko, and earlier there was also Men Zulig. I would like to thank Ernie Garilao and the Zulig Family Foundation for establishing this excellent program in memory of my father. I'd like to acknowledge too the UP College of Public Health and the UP College of Public Administration and Governance. Thank you for designing a program that will help our most promising leaders address a wide range of health challenges, from global pandemics to age-old issues that continue to plague our rural areas. I also wish to thank the partners for coming to meet the fellows, to support them on their journey, and to infect them with RRR enthusiasm and love of life. Most importantly, I have to thank the fellows. First, for choosing the noble path of public service, and second, for acknowledging your important role in developing healthcare systems for the poor. From as far back as I can remember, my dad was a die-hard IBMer. He started his career with IBM even before I was born. And we moved from place to place as he climbed the corporate ladder, winning awards and attending recognition events so lavish that my mom would talk about them for months after. When we moved to Thailand in 1979, it was a big deal for us. Dad got to hone his management skills in Thailand before his eventual ascension to become president and general manager of IBM Philippines. Even as an 8th grader, I could see that my dad was changing and growing more confident. On the other hand, he was still pretty silly, and his sense of humor always remained intact, fully intact. Although he could be intensely formal, like he once made us kids read a book on etiquette, and then he tested us chapter by chapter. He never took himself too seriously and managed to find the perfect inappropriate moment to slip in a sarcastic remark. But that's for another talk. Despite fun times, he always wanted anything he did to be excellent, and he always sought to make things better. When he was called to government service in 1989, this wanting to make things better, it was sort of like a desire to make life matter. This sense of purpose seemed to grow stronger. Suddenly, it was no longer about fun in the sun or the next big promotion. Instead, it was about helping Filipino workers in Belgium and even all of Europe. My decision to come home from the US in '95 coincided with his re-entry into the private sector. He joined the boards of many companies, both here and abroad, but most of his time was devoted to advising the government or representing the Philippines in international organizations like ABAC and working closely with NGOs like the Zulig Family Foundation. ZFF in particular made him open his eyes to the plight of the poor. And he shifted to full-on public servant mode, because now the most visible, the most confronting manifestations of climate change and poverty were in full view. Hunger, malnutrition, infant and maternal mortality, the lack of sustainable food supply, and so on. For context, Ondoy happened in 2009 and Yolanda in 2013. These were intense times for the nation and still are. He describes his personal evolution in a video that was shot fairly recently. We're going to show you that video in a little while. In it, he talks about the Anthony Hopkins movie, The Two Popes, and how solving poverty is not just one person's responsibility, it is everyone's. A specific line echoed exactly how he felt, that we all have a responsibility to do something about poverty, especially now, especially in this country, and especially given just how vulnerable we are to world weather patterns, and rising sea levels. The video was taken in 2019. By then, he had already hosted a series of conferences focused on earthquake preparedness and had already convened the National Resilience Council, bringing together various sectors, demonstrating the power of unity and communication. As a processing and systems guy from his early days at IBM, Dad was always focused on the implementation of policies and measurable outcomes. He felt that without meaningful examination and effective implementation, policies were nothing but ideals. Ultimately, he encouraged the development of local leadership for improved responses and felt certain that the path forward was to better the capacity of local mayors and governors. Those who have the most at stake, he said, those who have the greatest motivation to act should be in the driver's seat. When he received his Lifetime Achievement Award from the Joint Foreign Chambers of the Philippines in 2016, he said, "I have been privileged as a public servant and businessman to offer solutions to vital issues of my day. And my commitment to doing this is as strong as ever. No matter which government is in office, my advocacy will always be about building a modern, prosperous, just, and sustainable society." I cannot think of a more fitting way to memorialize my father than with these fellowships. For in order to build a better society, we need to have better people. On behalf of my dad, I am honored. We are deeply honored to accept and support this fellowship program for public health and leadership and governance. Thank you.
Thank you so much.
First of all, I thank all of you for
Let
being
us
present.
listen to the video mentioned.
So many speeches. I guess at one point. First of all, I thank all of you for being present. With so many speeches, I guess at one point I thought it was really a memorial for me. But let me assure you that's not true. Yes, I had to come in a wheelchair because for whatever the reason, when I stand up, my oxygen level goes down. And I talked to Dr. Divina Gracia, and she says, just go in a wheelchair and you won't, which is true. So please be assured, I don't always use a wheelchair, it's only today. Second interesting point, I have three. When I heard this was in Zuling Family Foundation was going to be in the turf room, I said, my God, since when did we spend money? So on that basis, Ernie, make sure that Danielle and David pay for this. Thirdly, it's been an honor and a privilege to work for the Zuling Family Foundation. And my career has been multi-career. And let me just say that, number one, I worked for some 25 years for the IBM Corporation. And that was probably the most formative of my years. And then after that, I became Secretary of Foreign Affairs for a very brief period. And that gave me 6 years of government experience. But beyond that, I also worked for the Zulik Family Foundation. And I worked from 1995 to present. So it's more than 11 years. And younger than people like Ike Ona and Frank Villano, but still, it's a sizable amount of time. And each one of my careers has been enriching. It's only this career which I attribute to my understanding and why I think often about the poor, the rural poor, etc. And I recently watched the tape of the two popes, and I learned something there. It says, why is the poor like this? Why is poverty like this, whether in the Philippines or elsewhere? The reality is, it's not anyone's fault. It's every one of us that's at fault. And we have to do something about that in the future. One last point, and I could go on, but I can't memorize everything that you people have said, but I think what is particularly significant is Secretary Ona mentioned it, universal health care. That is the hope of everybody, and it will take a great deal of effort on the part of all of us and the government come up with the final solution. They're coming through with some wondrous 31 pilots all over the Philippines. Each one slightly different or nobody quite knows. But at one point, it will have to be there, responsive to the needs of our nation. Fortunately for me, universal health care, we're one step ahead, and we're trying to align ourselves with the government. And hopefully the government will support our endeavors in the long term. At the end of the day, Zulik Family Foundation is not here just to feel good for ourselves, but to feel good to do something for the nation. So lastly, let me just thank the Zulik family for whom I have worked some 34 years, I guess. It's been a privilege and honor and an education. And to all of you here, to the ZFF staff who's done a great job, thank you very much indeed. And as flattered as I am that the tribute accesses to everything we've done, it's really not me. If anything, it's a pair. It's Ernie Garino and myself. And behind the scenes, Polly Garino. Now, as one last joke, SP just spoke on reproductive health, and she will now distribute it to all of you commodities. Thank you very much indeed.
Thank you very much, Ambassador Bobby Romulo.
Thank you very much for sharing sharing with us that video and the glimpse of the humor that was mentioned earlier. Thank you again, Ms. Liana, for sharing with us your message and for giving us a picture of how Ambassador Romulo was. At this point, may we hear from the Secretary of the Department of Interior and Local Government, Secretary Benjamin Abalos Jr., who is represented by Undersecretary Marlo Iringan.
The family of Ambassador Roberto R. Romulo, the members of the Zulig family, the Board of Trustees of the Zulig Family Foundation, the officials from the University of the Philippines, of course, our 4 governors, Governor Gonzaga, Governor Aduba, Governor Miraflores, and Governor Demaray, Chairman Ernesto Garilao of the Zwelig Family Foundation, our idol in the Department of the Interior and Local Government, our former Undersecretary for Local Government, now the President of the Foundation, Undersecretary Austin Panadero, esteemed officials, esteemed guests, a pleasant afternoon, everyone. On behalf of Secretary Benhursi Abalos Jr., we would like to extend our appreciation for the invitation to join today's launching of the Roberto R. Romulo Fellowship for Public Health Leadership and Governance. This endeavor is a significant step towards our collective aspiration of realizing universal healthcare in our country. No less than the Philippine Development Plan of the current administration envisions Filipinos to have long and healthy livable communities with enough opportunities for high-quality lifelong learning for them to become healthy, smart, and innovative people by 2028. However, events in the past, like the adverse effects of climate change and global warming, and the recently experienced pandemic, has challenged our institutions and systems in more ways than one. It impacted the lives and livelihoods of millions of Filipinos and created disruption to public service delivery, which tested our health system's capacities. These events revealed the vulnerabilities of our healthcare systems, likewise emphasized the need for our collective action to effectively address such challenges. And our gathering today is an important step towards this pursuit. Therefore, we are glad that no less than the key actors in local governance, our 4 governors, are the target participants of this program. Our local government units, as the front line of governance and service delivery, are given the arduous yet critical task in ensuring the delivery of efficient and inclusive services to include health to their respective constituents, especially in light of the implementation of the Mandanas-Garcia ruling. While we recognize that there are challenges faced by our local government units, especially in the implementation of programs and projects on health services, we believe that when we work together, the national government, our local government units, the private sector, like the Zwelig Family Foundation, our civil society, and the academy, when we put our heads, our hearts, and our hands together, we can make this world a better place to live in. Thus, through this fellowship program, which aims to enhance the capacities and competencies of our local officials, we hope that we can produce public health champions and transformative leaders who will be at the forefront of creating and implementing innovative, responsive, and inclusive health policies and programs, especially in our local government units. Having said that, we in the Department of the Interior and Local Government express full support and commitment in this noble pursuit of realizing universal health care in our country. Maraming salamat po at magandang hapon sa ating lahat.
Thank you very much, Yusek Iringan, for your message. So maybe we weren't able to listen to everyone's stories and sharings this afternoon, but your presence here today is already a testament to your willingness to be a part of this program and to, in your way, contribute to the improvement of health outcomes in the country.
And with that, may we now call on Mr. Daniel Zulig, trustee of the Zulig Family Foundation, to give us his closing remarks.
Dear members of the Romulo family, honorable governors, Eduba, Miraflores, Gonzaga, and Demery, esteemed academic partners, representatives of the University of the Philippines, partners in government and the development sector, dear friends of our friend, and mentor the late Ambassador Roberto R. Romulo. Good evening, and thank you very much for being here today with us. Let me state what we all know. Bobby Romulo is both absent today and present with us this evening. We are assembled here without him, but without him, we would not be assembled here. RRR or RRR was the thought leader and the spiritus rector of the Zulik Family Foundation. He instilled in us as individuals and in ZFF as an institution the vision and mission of achieving better health for the Filipino people. And today's event is a manifestation of his lasting legacy and his leadership. With this launch of the RRR Fellowship for Public Health Leadership and Governance, we reaffirm our continuing commitment to work with local health leaders in strengthening health systems, united in the common goal of ensuring universal healthcare and better health outcomes for all. We are gratified and encouraged to have had the opportunity today to recognize our fellows and associate fellows for choosing to respond to the health challenges in their provinces, for embracing their roles as champions for the health of their people. In addition, we express our gratitude to everyone who has joined us here this evening as we collectively remember Bobby Romulo's passionate engagement in the field of public health leadership and governance, and as we promise to take up and further develop what he initiated and set in motion. Our special thanks go to the University of the Philippines College of Public Health and the UP National College of Public Administration and Governance for agreeing to partner with the Zulik Family Foundation in establishing this program. Your expert contributions are essential to our shared endeavors towards equipping the country's health leaders with the tools that they need to be able to create positive impact in their areas of responsibility on the provincial level, in the municipalities, and in the barangays. In closing this launch of the RRR Fellowship for Public Health Leadership and Governance, let me assure the Romulo family that we will always uphold Bobby's legacy, his professionalism, his high expectations for excellent execution, his accountability for results, and his advocacy for more equity in health, especially among disadvantaged and risk-prone sectors of Philippine society. Thank you for your fellowship. Thank you for your health championship. Mabuhay.
Thank you very much, Mr. Zulig, for your message. And with that, our program today has come to an end. But the Romulo Fellowship is just beginning, and we can expect to hear great things and ideas emerge in the next few months. To begin the conversations, please feel free to take a look at the tarps outside our function room, which show the provincial profiles and their current health indicators. As early as now, you might already be able to identify potential areas for partnership as we dive deeper into the health situation of our 4 provinces.
That's right, Prof. Abby. Our program today has ended, but please feel free to still stay for a while. We will be serving some snacks for us all to enjoy. And even more so, we will enjoy the company of friends and partners who have come here this afternoon. Of course, we would also like to thank everyone who has been involved in planning and preparing, not only for this launch, but even for the whole fellowship program. Our teams from the UPCPH, UPNCPAG, ZFF, this would not have been possible without all of you. So again, maraming salamat po sa inyong lahat. And please enjoy the rest of the evening.